So through events like DSEI and like Medical Innovation 2018, the Defence Medical Services and Clarendon events have the opportunity to bring together healthcare practitioners and planners to share best practice and consider how innovation can further improve patient outcomes. So at Medical Innovation 2018 we'll be bringing together regular and reservist military colleagues, NHS primary and secondary care staff, paramedics and colleagues that work for charities and for non-governmental organisations to share their experiences and consider how innovation can benefit their patients. So at Medical Innovation 2018 we'll consider the whole of the patient care pathway. That starts with preparedness. It builds through the point of illness or injury, through investigations, diagnosis, treatment and then rehabilitation. What we'll also consider is the impact of that illness or injury on the carers. So we'll be focusing on the patient and caring for the carers. So on occasion there are circumstances where conflict or natural catastrophe and disasters or simple geography may delay the opportunity to evacuate patients to definitive care. So in prolonged care we'll be considering the innovations that might help improve the outcome for patients that find themselves being held for longer periods before they can be evacuated. So Medical Innovation 2018 is a really rich two-day programme. On the first day we'll consider preparedness and getting the team ready to look after the patient in these circumstances. On day two we'll think about some of the technological innovations that might help improve patient outcomes. These will include things like near-patient testing, new diagnostic and investigative techniques through imaging, and evacuating the patient in expeditious ways to improve their outcomes. We'll be particularly focusing on biosensors and the ability to use artificial intelligence and big data to inform healthcare decisions. This can help reach forward to provide clinical information to doctors in remote environments treating patients, and also reach back whereby specialist support can be provided from remote locations. We're especially pleased to have Professor Yang from the Hamlin Centre at Imperial College, who is a world leader on robotics and biosensors, giving the keynote. The biosensors that we developed for exercise Ice Maiden, which was the first all-female party to cross Antarctica under their own steam, demonstrated the ability to send physiological data back from a very remote environment to the UK situation to inform healthcare. They'll be sharing their experiences with us and telling us what we can learn from the data that we recovered from them.